What are autoimmune diseases? The body's immune system plays a key role in maintaining our health. However, there are cases where it mixes up its role and treats elements of our own body as the enemy. The result is autoimmune diseases, which affect 5% of the population. The immune system together with the neurosensory system determine and maintain the integrity of the organism. The immune system consists of cells that circulate in the blood and are also found in almost all tissues. It performs its function using a complex network that constantly receives different stimuli, communicating simultaneously with the nervous and endocrine systems. The role that the immune system must play in order to make a decisive contribution to the smooth survival of the organism is twofold. On the one hand, it must recognize and fight against factors harmful to the organism, such as pathogenic microbes, and on the other hand, it must recognize, tolerate and not react to its own elements and to factors that are helpful for its survival. For example, the elements in food or the microbes in its gut. When an organism's immune system reacts and paradoxically destroys its own elements, for example proteins circulating in the blood or cells in an organ, a disorder is created which cannot be controlled and healed by the organism. The result is a disease called autoimmune disease, precisely because the body does not tolerate its own elements, but recognizes them as foreign and harmful and destroys them by various mechanisms. This disturbed reaction of the immune system is caused by the influence of certain environmental factors such as microorganisms, radiation, or stress. Autoimmune diseases affect women more often. They are not inherited from mother to child, but several members of a family tree may suffer from different autoimmune diseases. Autoimmune diseases manifest themselves with a variety of symptoms, such as fever and joint pain, rashes, or hypertension. As a rule, they are chronic diseases with flares and remissions. The sooner they are diagnosed and treated, the better their response to medication. Many of the autoimmune diseases are identified by the specialist doctor by clinical examination. However, in some of them, the doctor will need special laboratory testing, and in others a biopsy of the affected organ may be required. Their treatment consists of long-term administration of drugs that modify the immune response under close medical supervision. The therapeutic interventions of recent years have been able to make a decisive contribution to improving the daily lives of patients and the course of these diseases.